I would like to go ahead then and introduce our speakers for the day. Our first speaker will be Cristina Romanelli. She is the World Health Organization's Climate Change, Biodiversity, and Health Focal Point, located at WHO headquarters in Geneva. And our second speaker will be Catherine Machalaba, who is the Principal Scientist for Health and Policy at Eco Health Alliance. They both have impressive bios, and I am hoping that what I can ask both of our speakers to do is to briefly give just a few words about their own backgrounds before they begin their presentations. So first, I'm going to turn to Cristina, and I will get your presentation up while you say a few words about yourself.
Thank you so much, Julie. It really is such a pleasure to be joining you, to be joining you all here today. So as Julie just mentioned, my name is Cristina Romanelli. I am the Biodiversity, Climate, and Health Focal Point at WHO headquarters, which has been preceded by a background in which I was in which I led the joint work program on biodiversity and human health between the World Health Organization and the CBD Secretariat, so the Convention on Biological Diversity. And I've been working in this space for approximately 2 decades. So that does give away my age, but in any case, it's really a pleasure and an honor to be here with you all and to be a part of this series. So I think I'm just gonna jump right on in. If we go to the first slide. I'm gonna begin my very brief talk by painting a bit of a grim but very real picture so that we can set the scene for the discussion and not lose sight of the urgency of the problem. So as you can see here in this figure, the most recent report by the World Economic Forum recognized climate action failure, extreme weather events, and biodiversity loss as the top 3 global risks that we're facing today. The top 3 global risks that we're facing, which will, in fact, require substantial investment and transformative action. And one of those opportunities for transformative action is precisely around the area of One Health that we'll be talking about today. So if we move on to the next slide, we see that our Director General, Dr. Tedros, has repeatedly, time and time again, really acknowledged that the climate crisis is, in fact, a health crisis. And it's no surprise because decisive climate action combined with action on biodiversity loss, because we are facing, in fact, a triple planetary crisis, as most of you have likely heard. But in fact, addressing these crises concurrently can help to cut the global health burden of disease to half moving forward. So we're looking here at something that is we're discussing here the climate crisis, but we can't forget that these crises are indeed concurrent. So moving on to the next slide. Can you still hear me? Because I think something may have happened to the connection.
We can hear you perfectly. I think maybe Julie may have dropped off.
I did, and I apologize. I am back.
Okay, that's not a problem at all.
I'm sharing the screen again. I am so sorry.
Please don't worry about it, Julie. These things happen, and we have to be adaptable, right? I mean, the crises we face do require a tremendous amount of adaptability. So, so don't worry about it. This is just a small technical glitch. Are we there? Is it okay now? Yeah. All right, great. So I was saying that we are concurrently facing a very real simultaneous crisis, and one of biodiversity loss. And the evidence on on that really is clear. In fact, if we really think about that evidence, we've altered 3/4 of our terrestrial landscapes and 2/3 of our aquatic environments. The reality is that up to 1 million species right now, today, are threatened with extinction. Up to 35% of wetlands globally, which are in fact home to 40% of the world's biodiversity, disappeared over a 45-year span. And tropical forests, which is in fact where forest carbon storage and sequestration rates are highest, accounted for over 90% of global deforestation between 2000 and 2018 alone. And like those, we've got statistics upon statistics. And what does that really mean? That means that looking at the degradation, terrestrial degradation alone, 75% of the Earth's lands are substantially degraded, which is actually undermining the well-being of 3.2 billion people. This is half of humanity that is currently at risk, thanks to our uncontrolled anthropogenic activity. And if we move on to the next slide, when we think about these statistics, they are stark, they are alarming, but none of this evidence really is new. For some, the reality may be new, but in reality, WHO has started working on this evidence and data some 30 years ago, as well as implementation of preventive climate action for health. And approximately, I would say, some 20 years ago, with the Millennium Ecosystem Assessment and the State of Knowledge Review on biodiversity and health, on catalyzing health leadership for biodiversity and health. So we see that the crises are enormous, but it is also there is tremendous opportunity for evidence-based actions. What you see here is only a photo of one of numerous WHO publications, and this one is of the State of Knowledge Review, to which we may come back a little bit later. And it does address everything from air and water quality to freshwater systems, food and nutrition security, mental health, climate change, disaster risk reduction, biomedical discovery, traditional medicines. But behind all of that, talking about the complex interlinkages that are behind all of those. And what does bring it together is the way forward, because it recognizes that holistic approaches such as One Health are in fact essential to addressing the full spectrum of our sustainable development challenges. And while we're on this issue of evidence, while we're discussing scientific evidence, there's also a report that I'd like to flag that had just come out 1 week ago, approximately, by the Intergovernmental Science Policy Panel, a science policy platform for biodiversity and ecosystem services. And it's a new global assessment. It's not the first, but it is the most recent global assessment, and it's on invasive alien species. And in that IPBES report that just came out last week, we have a sense of the economic impact that is really being caused by ecosystem degradation and by biodiversity loss and by our changing climate. So in the case of invasive species alone, that report shows that more than $423 billion in annual losses to the global, it's causing to the global economy globally. And the resulting losses are a result of damage to ecosystems, to disruptions to food systems, to threats to human health. And I'm fairly confident, working within the global health community, if you talk to them about these reports, not a great many of them are very familiar. Yet, invasive species, such as disease-carrying mosquitoes, can pose threats to human health by transmitting diseases like malaria, dengue fever, Zika virus, all of the ones that I'm sure we're going to be discussing in that chat. But at the same time, those invasions can really disrupt ecosystems, affecting their ability to provide essential services to us, to people, including the maintenance of fisheries, regulating rainfall patterns, and purifying drinking water. And combined with global warming, they've also led to very real or exacerbated, if you will, very deadly consequences. Wildfires are a great example of this. In fact, we've seen wildfires that have been fueled by invasive grasses in regions like Hawaii, in regions like Chile, and in Australia as well. So moving on to the next slide, as I feel I'm taking more time than I should be.
You are perfectly fine.
Invasive... Great, that's very reassuring. Thank you. We see that invasive species are really just one small part of a much larger global spectrum of global health challenges that are really being exacerbated by our changing climate. And what we really need to retain, what you can see here, are what some of those grand global health challenges are. But what really needs to be remembered is that the way forward from here, not only the magnitude of the challenge, but the way forward from here means that we meaningfully need to take action on prevention as the most effective way to combat the health risks that you see here. And the cost of inaction, both monetary and in terms of lives lost, and in terms of threats to ecosystems, and in terms of threats to plants and animals, is exceedingly high. Combined, these provide a tremendous opportunity for One Health moving forward. But we also see in the next slide that those that are most directly affected are often those that are least responsible for biodiversity loss, for climate change, and those that are most directly reliant on biodiversity, on healthy ecosystems for their health and for their subsistence. You see here what that vulnerability represents. We won't go through all of the statistics here, but suffice it to say that the context within which these measures that we're going to be discussing in the discussion today need to take into account that context of vulnerability, which varies from population, from country to country, but also within countries from population to population. Moving on to the next slides, we see that we know that in addition to the threats to environment and development, the loss of biodiversity and climate change takes an enormous toll on human health. In fact, that toll is so large that 1 in every 4 premature deaths is attributable to preventable environmental factors. And infectious diseases are, of course, a perfect example of this, as infectious diseases don't actually know any borders. But what we know now is that according to recent estimates, there's over a 40% chance that we will know in our own lifetime a pandemic that is at least as serious as COVID-19, unless we take decisive action. And that's just infectious diseases. Diet-related diseases, air pollution, the full range and full spectrum of non-communicable diseases are actually now superseding infectious diseases as the leading cause of premature death. So what does that mean? That means that when we're thinking about how to move across these challenges, we have to put our money and our investments where the health burdens are. And these are indeed investments. They're not a cost. They're investments in our health. they're investments in our future, and they're actually more cost effective by up to a ratio of 10 to 1. As one example alone, ecosystem services alone represent an estimated economic value of $125 trillion annually. So as we can see, and what needs to be borne in mind is that while these challenges are enormous, so are the opportunities. If we move on to the next slide, this can appear like a confusing slide, so let me just summarize it very briefly. What happened was that a few years back in 2018, at the 14th Conference of the Parties to the Convention on Biological Diversity, so the primary decision-making body for the CBD, Biodiversity Inclusive One Health Guidance was adopted. So that means, no, that's the one. Yes, thank you. And so that means that by consensus, countries had acknowledged that there was a need to collectively work across sectors, work across disciplines, work across different layers of governance in a much more open and inclusive, through a much more open and inclusive and dedicated approach to address the concurrent challenges that we face. But what happened? This is pre-COVID. So what happened is that most countries, while they adopted this terrific guidance, almost, by consensus, almost no action was meaningfully taken on the ground to meaningfully embed environmental determinants. But then, of course, COVID-19 came along, which was a wake-up call the world over, making absolutely clear that we could no longer face global health threats in isolation, that we needed to be working through and across those different boundaries. So moving on to the next slide, as I realize I'm taking quite a bit of time, as a first essential step at the global level was the expansion of the Tripartite Alliance of One Health to include the United Nations Environment Program. Because it was clear that we couldn't keep working even through One Health approaches, which had largely focused to that point on the human-animal interface. It was clear that we needed to bring in more of those environmental determinants. So about a year and a half ago, a new era of collaboration emerged as the Tripartite Alliance expanded to become the One Health, the Quadripartite Alliance for One Health. And if we look at the next slide, at the same time, we had established One Health, an independent One Health high-level expert panel, of which our next speaker is a part. So very exciting to be on this panel with Catherine, a very long time collaborator. But one of the most exciting things that came out of what is the OLEP is that a new inclusive definition of One Health had been developed and adopted as a common definition by the 4 quadripartite agencies for the first time in history. And what's particularly exciting to me about this definition is that it meaningfully incorporates the environmental determinants of health, making explicit the need to tackle threats to health and ecosystems, but while also addressing the collective need for clean water, for energy, for air, for safe and nutritious food, for taking action on climate change, and for contributing to sustainable development. This definition is golden, and I'm sure we will have the opportunity to really think about what that means in terms of its operationalization. And I'm sure Catherine will have a tremendous amount of insight in that regard. But if we were to keep moving along, in addition to this common definition that we had on One Health, what also happened was that this quadripartite alliance that we just mentioned adopted a global plan of action on One Health. That global plan of action was launched just last year, in October last year in Berlin. And It is essentially comprised of 6 pillars, which you can all see here. So, of course, there is the strengthening of health systems, and we're looking at vector-borne diseases, and we're looking at antimicrobial resistance. But what I want to bring your attention to, and what makes this global plan of action most novel, is that for the first time across these organizations, we've got a specific and dedicated action track that specifically focuses on the environment. And its overall objective is to protect and restore biodiversity, and to prevent the degradation of ecosystems and the wider environment, to jointly support the health of people, animals, plants, and ecosystems that ultimately underpin sustainable development. The next slide, I think, is a good summary of some of the concurrent, numerous concurrent One Health challenges that are posed by climate change and biodiversity loss. As you can see in these little boxes, these span from land use change to agricultural expansion and illegal wildlife trade, to climate change and extreme weather events, which ultimately come to compound the health impacts of ecosystem degradation on both people and ecosystems. But one of the biggest challenges that we continue to face right now is one of financing, because climate and One Health action are severely underfinanced, and the magnitude of the investments that we make in these preventive actions is not nearly representative of the magnitude of the challenges that we face. At the same time, there's also a significant lack of political will globally, or there has been. I think this is slowly changing. We're seeing a shift, definitely in the right direction. But there has traditionally been a lack of political will to recognize these concurrent threats. And one of the things I always say is that where there are great threats, there are also tremendous opportunities. So in the next slide, we see what some of those opportunities are. And of course, they're part of the same storyline. They emanate from at the global level, from World Health Assembly decisions, from conferences of the parties. So what you see here is a reference to the 15th Conference of the Parties to the Convention on Biological Diversity, in which what was called the Kunming-Montreal Global Biodiversity Framework, which is a 10-year framework to effectively safeguard, manage, and restore biodiversity. It's comprised of 4 overarching goals and 23 targets. And what's important and exciting about that is that One Health has been explicitly identified as an opportunity to tackle each one of those 23 targets moving forward. At the same time, we know that we've got the climate COP that is going to be coming up in Dubai at the end of November and in December. For the very first time, we will have a very special day that is dedicated specifically to health, and also the very first ministerial roundtable on climate and health. So we do see that there is a step change in the right direction. And countries, what can countries do at their own national at the national level is they can also strengthen through their nationally determined contributions. They can also contribute to the development of what are now called health and national adaptation plans, to which WHO does provide some country support for strengthening climate resilience moving forward. And we also see a more recent commitment, which was made public just a few days ago, actually, through the G20, in which we see a firm commitment to strengthening global health and to implementing the One Health approach. specifically a commitment by G20 countries to strengthening the global health architecture with WHO at its core to build more equitable, resilient, sustainable, and inclusive health systems to achieve universal health coverage, but also to implement the One Health approach and enhance pandemic preparedness and strengthen infectious disease surveillance systems. But as we say that, while these are very crucial and laudable engagements moving forward, we have to think of One Health through a much broader lens. It's not just about pandemic preparedness. It's not just about those infectious diseases. It really does cover, and if you go back to that definition, it really does cover a much broader and wider spectrum of health disease burdens. Therefore, by focusing only on that pandemic preparedness, we're actually narrowing the potential that One Health holds moving forward. So I think that we can move to the next slide. Yep. And here I'm just giving note the previous one. Sorry, the previous slide. We just skipped through that one. Yes. So here is just I was talking about what can countries do or policymakers do at the country level, and nationally determined contributions are part of that. And through an analysis that we'd carried out a few years back, I think it was in 2019. We've analyzed some of the vulnerability and adaptation assessments that had been taken place, and we see that in the majority of those analyzed, 3/4 are in fact worried about vector-borne diseases, as well as waterborne diseases and other infectious diseases as key threats posed by climate change moving forward. So the nationally determined contributions that we are talking about in the next slide combine. Sorry, can we move to the, yeah, that's the one. Thank you. Okay. So in the analysis that we had carried out of the different nationally determined contributions, we see that vector-borne diseases were in fact highlighted in 33 of those NDCs. And we also see, as I was saying, these are great challenges, but also great opportunities. And one of those tremendous opportunities is around nature-based solutions. So nature-based solutions are not only beneficial to people, to the environment, but they could also have the potential, combined with other solutions, to meet up to 1/3 of the climate mitigation and adaptation potential that is needed to achieve the targets of the Paris Climate Agreement. But what happens if we don't? What happens if we don't? What happens if we continue to leave biodiversity loss unabated, for instance? Well, if the Sustainable Development Goals are our benchmark, then I think that we have to bear in mind that based on current negative trends, and this is just on the biodiversity loss component alone, the loss of biodiversity and degradation to ecosystems undermines progress towards 80%. So 35 out of 44 of the assessed targets of the Sustainable Development Goals relating to poverty, relating to hunger, relating to health, relating to water, relating to cities, to climate, to oceans, and to land. So I think that with that, I will leave it here because I have gone on for quite some time, and I'm very much looking forward both to Dr. Machalaba's presentation and to the discussion period that will ensue. Thank you so much for your time.
Thank you so much, Christina. That is an amazingly comprehensive background and really a fascinating look at all of the areas in which climate change and health are intersecting. I think beyond what we often superficially immediately look at as the immediate health effects and the infectious disease threats. And appreciate you laying the background on the international agreements, some of which have developed extremely recently. And I think that that's a really powerful overview of where we are now in the global compacts and frameworks that are moving forward as we look at more, hopefully more commitment and more attention from multiple sectors. And so thank you so much for that. And I'd like to move now to Catherine Machalaba. Dr. Catherine Machalaba is coming to us from the Eco Health Alliance, where she is the principal scientist for health and policy. She has worked on many operational issues and operational frameworks in this area. I would like to invite her also just to say a few words about herself before beginning her presentation, which I will pull up right now. And I understand, Catherine, that you're joining us from one of your projects. So thank you so much for making the time to join us today, and look forward to hearing how we can keep building on what Christina has so powerfully presented.
Thank you so much. Thank you for the opportunity. It's really an honor to be with you. I am in beautiful Liberia, so it's a great place to be, but sometimes the internet is not reliable. So I hope to stay. But thanks for your patience. If I drop off, I'll make sure to rejoin ASAP. But thanks, Julie, for showing the slides, and thanks, Christina, for the great overview. And I have to say, my focus was really to give you a sense that climate and health are also linked to ecosystem degradation, our treatment of the environment, biodiversity, some of the things that we really see in policy frameworks that are treated very separately. So I think Christina has done a phenomenal job in really making us very very convincing argument and making us understand those links. So thank you, Christina. And I will just highlight in my presentation a few examples from our projects, including here in Liberia, but also elsewhere. And I hope in the discussion we can also delve in further to these opportunities that we can really scale up and learn from and apply to these, in these context-specific approaches that we've heard about. So if we move to the next slide, I just want to briefly highlight this new definition of One Health. And I think many of us relate to different terms. Planetary health, I myself have a PhD in planetary health sciences. We relate to them differently. And I think our disciplines and our sectors align sometimes with certain terms. And I think that's great. So if you prefer a different term, integrated approaches, that's really what it's all about, where we need to be moving. But this harmonized definition of One Health that was adopted by the 4 intergovernmental agencies that you see here on the screen, including our friends at WHO, it really, I think, signifies that we have to think about that balance of ecosystems, people, animals, including wild and domestic animals. And really, I think what's nice about this definition is that it shows it's very inclusive. And so by having this harmonized definition that calls into attention energy and air, safe and nutritious food, taking action on climate change, this really is a call to action about how we have to work together in our treatment of our local and global environment. And if we go to the next slide, you'll see again this definition visual where we're really thinking about One Health as healthy ecosystems, healthy humans, healthy animals. And at the center of the prior slide, we saw that collaboration, coordination, communication, and capacity strengthening are really the ingredients to get there. The things that we're doing every day in our work, all of us on this webinar, but we really need to do this in a more routine way and build the system so that it's not just person dependent, so that it really becomes process dependent and we break those silos. I just want to say, again, I think a One Health approach, with those key ingredients, but it really comes down to balancing trade-offs and co-benefits. We want to understand what's at risk when we take a certain action. We really want to understand too how we can maximize those co-benefits. So resources, investments, as Christina was saying, how we can really get the most for our money. And I think that's something that we haven't really looked at as a society when we think about maximizing how we treat our environment and how we protect our environment in particular, and the really important health gains that come from that. And these definition foundational principles, I think they're very important. I will just call our attention to them when we think about equity, when we think about socio-ecological equilibrium, really the intrinsic value, animal welfare, stewardship, and also really traditional forms of knowledge that we haven't always given the same attention to as modern forms of knowledge. And so I think from an equity standpoint, inclusivity, we have to also do things differently when we see, who are the stakeholders that need to be at the table. So I hope you look at these principles further online. I can put the link in the chat to them. If we move to the next slide, I think, something we can celebrate, this One Health Joint Plan of Action. It's recently been launched. Christina can really tell us more on this, but just to call to our attention that there's a dedicated action track on integrating the environment into One Health. But also really climate and biodiversity and environment as a whole are cross-cutting when we think about all of these different action tracks. So emerging infectious diseases, neglected and tropical vector-borne diseases, food safety, AMR, there are climate links to all of these. So I think we have to really embrace that when we look, including towards COP28 and the Health Day, that we have the opportunity to really get the message about these links and show that, we can't have these entirely separate climate agendas. We can't have these separate health agendas. We have to bring together the actors and the solutions, the resources, but we also can't forget about biodiversity and other key components as we do that. If we go to the next slide, and thank you, our wonderful water quality expert was just saying hi here. So we really have a One Health team here on the ground too, which I'm very excited about, and hopefully I can talk more about that in the discussion too. But just building on Christina's wonderful overview about the work that's already been done, the evidence is very strong. There's no question that our changes to our climate, our environment as a whole, are affecting our health. And there's an economic consequence, as Christina mentioned, and that estimate about impact of invasive species, which of course climate change is facilitating the movement, the spread of invasive species, really what's at risk, what's at stake. The evidence is extremely clear. I think we, from research, always need to do more research. There's always more to learn and there are knowledge gaps, but we have so much evidence that we need to act on and really do the most that can be done now. And I just want to highlight here, there are climate reports on this slide, but there are also other reports that, again, as Christina mentioned, we might not always think are relevant for health, but they're extremely relevant when we think about what needs to be done, the solutions, the investments really upstream. So this opportunity, especially when we think about new priorities for protecting tropical forests, for example, and restoring these crucial ecosystems, which really have climate services that contribute directly and indirectly to health. If we move to the next slide here, just to say context really matters. So I'll give a few examples of our work that I think our projects look very different based on the actors, based on the issues, based on the information sources. But when we think about a One Health approach, we need to have the right sectors in the room, but it's not always everyone working together all of the time. We need to really build up these systems. I think we are very passionate, all of us, about building up public health systems. That's extremely important. As we do that, we can really think about how do we build up animal health systems? How do we build up environmental health systems where we know there are chronic gaps? Things like field epidemiology training programs, making sure that the animal health sector, and certainly domestic animals, but also wildlife, making sure that environmental, sanitation, waste management, water protection, that those are all really included when we think about epidemiology and making those links and working together. So I think that's an opportunity for us to identify those entry points, invest in them, and really conduct our trainings in somewhat of a different way, broadening the scope of who can benefit, making sure the sectors are really up to speed and able to work together optimally. And then the next slide here. So Christina gave a beautiful overview about health benefiting ecosystem services. I will just say, we can think about this certainly from the risk side, how risks are changing. We can think about this from the burden side and what we need to be measuring and really working to reduce the impact from. But we can also be thinking about missed opportunities. And this is something crucial when we think about climate investment, when we think about the priorities and the different processes, and also how we can optimize biodiversity and ecosystems too, and also social inclusion and equity, all of these important goals that we have to really bring under the sustainable development umbrella through a One Health approach. We can move to the next slide here. And I think this is something everyone would be very familiar with in terms of moving upstream. But I think an important parallel, and Christina mentioned adaptation, we have to really be able to adapt very quickly. We have to be dynamic. That is incredibly important in our public health systems, our animal health systems, environmental health systems, and increasingly so with climate change, unfortunately. I think we sometimes use different terms. So prevention and response, mitigation and adaptation. I think we are very, when we look at where investments are made, we're very often focused as a global health community about adaptation, response. It's incredibly important. We can't forget that. We don't want to stop investments there, but we also really need to be thinking about ahead of the curve, moving upstream, prevention and mitigation. So I think that there's a crucial opportunity there where health and climate, that the combined expertise can really create new solutions, new innovations. And so that's quite exciting when we think about those opportunities. Moving to the next slide, I just want to show some work on the ground here. And there's a really interesting project called What's the Fever in Liberia. There's also some sister projects that are looking at related topics in other countries, so we can really see, what are some common approaches. I think, again, context is very important. So here in Liberia, there are certain practices. People are coming into contact with wildlife in certain communities and certain livelihoods, and it puts them potentially at risk of zoonotic disease transmission. There are also pathogens pathogen exposures occurring every day. People are going to the hospital with fever. It's non-specific. It might be malaria, it might be something else, or it might be a co-infection. And we really don't always have good diagnostics to be able to precisely diagnose what's going on. I think this is a real challenge in many countries, especially when you get to rural areas during the rainy season. You can't always get to healthcare facilities, and then there are technical barriers. We really have a lot of challenges here. We don't always look at those modifiable behaviors. So what are people doing in their day-to-day work, their day-to-day lives, where those exposures are occurring? I think from a climate lens, this is really concerning, because if we currently have these issues, they're only going to get worse. And we see that with the spread of mosquito-borne diseases and really shifting ranges and where vectors are able to not only be introduced but established. And I think this is concerning from a disease standpoint, climate sensitive disease risk, and also the real threat to our critical infrastructure. So even if we do have well-functioning hospitals, in the future, those may be vulnerable if they're in low-lying areas. So I think we have to be really taking a very proactive stance when we look at something like this, and using all of our available entry points and saying, okay, how can we not just respond to disease, but also really work to modify behaviors, reduce risk as a whole, and be safer as a society. So I think, again, that's a key opportunity here. Moving to the next slide, just to showcase our work on Rift Valley fever in South Africa. I think this is an incredibly exciting project. It's now in its, I believe, 9th year, and we have really learned a lot, and there have been many partners involved. You can see here really these different project components. Climate and weather are very important components of this, but they're only some of the components that go into this. So you see soil science, vegetation, mosquito population monitoring, livestock, human epidemiology. There's so much that goes into this information, the farmer, engagement, and really their role in creating incentives to vaccinate. And I think that, we have to do One Health research, we have to do One Health public health practice in such a way that we don't forget about these other disciplines that are really crucial. And I think, that takes resources, that takes time, it takes being dynamic and really seeing, oh, we've missed a partner, we need to add in the soil science. And that was something that came in later in the project. And I think it was amazing that our partners really allowed us to have that space to do that. I'd really like to thank the Defense Threat Reduction Agency for their vision on One Health. They've been really proactive with many country partners around the world to bring One Health into research. There's a lot that we can learn from our collective knowledge on, who are the stakeholders, what pieces need to be brought in, and really think about how we can optimize One Health research. Moving to the next slide, I'll just go very quickly here. Conservation works in Liberia. I just want to, highlight that in West Africa, there is critically important tropical primary forest, and this is crucial when we think about carbon storage. Liberia itself holds 43% of the upper Ghanaian rainforest, so it's incredibly important. Other countries have really seen a lot of degradation of land, and we don't get those climate services that we know are so important. Of course, biodiversity is crucial to having healthy forests. If you lose the animals, if they're all hunted or traded, this is a big problem in terms of that longevity of forests and the health of forests. So we have to think about how it all fits together. This is a really exciting project that USAID has, I think, embraced the One Health approach, and it's so refreshing to see that. It's so refreshing to see the partners that really then come to the conservation table, see why it's important to think about protected area management, establishing new protected areas, but do it in such a way that we also think about economic prosperity and making sure that communities are benefiting. As things like ecotourism are introduced, we can really see that there is a win-win, but it has to be done in a One Health way. We don't want to create new risks in terms of health exposures. So I just want to say, from a conservation standpoint, taking a One Health approach, building that in when we think about climate services, ecosystem services, there are real opportunities. And I think this is an innovative way forward for conservation and health to work together. If we move just quickly to the next slide, I won't go too much into this, but just to say there's a very strong economic argument of that, of really protecting vital ecosystems where you get those carbon sequestration benefits, but also create new revenue streams. And I think that building that in terms of One Health cost benefit analysis will allow us to see these co-benefits more directly. So a new area for us to work together on. Moving to the next slide, I'm just going to quickly go through this. We have to invest in communities. We have to really make sure that those on the front lines every day are able to certainly benefit, but also see their role in protecting, as stewards of the environment, report disease proactively as they're seeing disease in their community, making sure that they are part of the public health system. I think this is something that we often forget. Or it's really hard to do because of remote links. And that's where eco guards, that's where park rangers are so vitally important to engage. I just want to highlight here our colleagues teaching this Living Safely with Bats book, Under the Mango Tree. People were initially concerned about bats in their communities. You don't want people to get the messaging about public health risks and say, okay, we're going to cut down the mango tree because the bats are roosting there in our community. You want to really say, no, this is important for soil. You want to prevent soil erosion. You want to have those ecosystem services, but you want to do it in a way that is safe for wildlife and for people. So I think that balance of messaging for public health outreach is really important from a One Health standpoint. Moving to the next slide, just briefly, so how we think about information that we collect and analyze. I think that if, from a climate lens, we know that there's critical infrastructure that's potentially at risk with climate change. If we think about sanitation infrastructure, for example, and safe drinking water and the effects of climate change, if you do get some really extreme weather events, and we know those are increasing in frequency and impact, do we have the ability to cope? So some countries, they have very low healthcare worker infrastructure. Also, if we think about veterinarians, the role of different sectors, are we ready? And I think we know, unfortunately, that we're not ready for many disease threats that we've seen that in the past few years and decades. And just thinking about what we need to be investing in, and are we ready for really a changing climate and a changing ecosystem? From a One Health lens, I think our workforce will look fundamentally different. Moving to the next slide. Just to showcase here, and I promise I'm wrapping up, early warning systems, we really can benefit from having this lead time. This is some really exciting work that our colleagues at NASA and now at Oak Ridge have done. Asafa Nyamba, really a brilliant scientist who has been looking at predicting ahead of time El Nino cycles and seeing how people and also animals can be exposed. And it's not just infectious disease, but it's really across the board, haze events. We know that these can, of course, then be linked to susceptibility to infections or changes in nutrition that can then make people more susceptible to disease. But this is an incredible tool. If we can think, 6 months ahead and make sure that we're prepared, I think that's vitally important and something that we haven't really optimized in terms of remote sensing. So an opportunity again to all of us, both from animal health and human health. Just one more slide here in terms of useful tools to highlight. We can put these in the chat as well, but some that are really underutilized from a One Health standpoint, making sure that as we are conducting, climate change and health diagnostics, as we are conducting the health vulnerability, the HNAPs that WHO has been leading, really making sure that we have animal health and environmental health colleagues in the room to think about zoonotic disease and also disease risks to animals themselves. I'll put those in the chat. And then I just want to talk about 2 quick initiatives. So investing in prevention through the Nature for Health initiative, and then also really on the next slide, the benefits of that. So maybe if there's time in the discussion, can just highlight these. But I think the benefits, if we go to the last slide, they're really strong when we think about a One Health approach, especially for emerging diseases. We can also point to some examples from endemic diseases. But what's crucial is we don't get these benefits if we don't take a One Health approach, if we're really not bringing together the climate community, the health community, if we're doing things in silos, it just won't work. We won't invest in the right places. We won't do things the right way. There is some marginal cost of investing in a One Health approach to enable this wonderful co-benefits, reducing the trade-offs, but it does require doing things differently. So I think that's a message to, when our public health colleagues are going and talking to finance ministers, try to create that engagement so that there is this awareness that, don't be surprised when also the animal health, the veterinary services come to you and say, this is important and let's line these up. I think that's something that the finance ministers really have a crucial enabling role here, and we can get them on board for these co-benefits. So I just want to thank you so much for the opportunity. I look forward to the discussion, and thanks again, Julie, for the chance to present. Sorry, Julie, I think you're on mute.
You are right. If only we had done any remote meetings in the last few years. So first of all, I want to thank you so much. This has been an amazing depth of background from both of you. I know we're running up hard against the hour and we may lose some of our participants, but if you and Christina have a few minutes to stay and talk, that would be great. So there's a note in the chat. I want to make sure that we acknowledge that. And then I have a couple of questions that I would like to start off with, and then invite everyone here. Please, those who are here today and able to stay on, if you have any questions, you are more than welcome to drop them into the chat. You're more than welcome to come on camera and ask them out loud, or to raise your hand using the raise hand function in the reactions at the bottom of your Zoom bar. If you would like to ask your question without attribution, please message it to me directly, and I will ask it of our speakers without giving your affiliation. So Justice Obara from Kenya has put a note in the chat about leptospirosis, one of the neglected tropical diseases. And his point is that he did studies on this earlier in his career, but it's so easy to lose track of the status of both the science and implementation as it moves forward. And like his question is, what is the current status of leptospirosis and the focus on that in Africa? And his point is also that there's still a lot to be done on neglected diseases. So if either of you would like to comment on that, that would be fantastic.
I can just come in briefly and say, yeah, thank you so much. And great to have a colleague who's working on zoonotic diseases and neglected diseases, and also plant biotech. I think that's amazing to see the evolution of the interest and the expertise. I'm sure there's a lot of synergies there too that we could explore. I will do a quick search in terms of the latest information, but my impression is that if it's not one of the priority diseases, there's challenges in tracking these neglected diseases, and we sometimes don't know about the epidemiology that's as up to date, and I think that's a real gap. And it leaves us vulnerable, especially something like leptospirosis, where you do have the flooding risk, and there is a very clear climate link there in terms of exposure, vulnerability, and also the impact. So let me do a quick search online to see if I can find a bit of information. I'm sure WHO Africa region has brilliant resources on it. But Christina, please, over to you.
I was just going to suggest the WHO Africa region for the research resources that you speak of, actually. And I mean, yes, exactly what Catherine was saying in terms of the enormous challenge of tracking these diseases, and it's also part of what Catherine was also saying earlier about the need to really strengthen health, each of the individual components of One Health and health systems at their core, and strengthening some of that surveillance and monitoring is definitely at the heart of that. And also to note that in that global plan of action, while we didn't really focus on it, but there is an action track that specifically focuses on neglected and tropical diseases. So I would invite you to maybe even look at that, particularly as we are now moving from what is this global plan of action on One Health toward a global plan of implementation, which can give you some ways forward, and will be launched actually at the next climate COP.
Thank you so much to both of you for that. I would love just to ask a couple of questions. Thank you, Catherine, for your rapid research skills as well. I have a couple of questions, and Christina, I'm glad you brought up, moving into the upcoming COP. I think that there's two, I think, major issues I'd like to ask you both about, and then turn to you both to answer in whatever order you'd like. The first is, as we move into the first health day at the upcoming COP, obviously it's a tremendous international engagement, and there's going to be the agenda is already really busy. But in your perspective, as you look at this health day, first, with an eye toward the stakeholders question and making sure that all the stakeholders are engaged at the country level and the local level. Really, my questions are both about stakeholders. At the COP, the highest level, who do you think needs to be alerted, engaged, that's not already at the table, that needs to be, that this opportunity is the health focus at the upcoming COP is an opportunity to really engage. So who needs to come to the table who's not there yet at this high level? And then my second question is also about coming to the table. Catherine, you talked about operationalization and ways of engaging community partners. Christina and Catherine, you both pointed out that ultimately the impact of climate on health is at the local level for vulnerable populations. Their participation and understanding what we can actually do to mitigate at the local level is also absolutely critical, but it has been hard at a grand scale to figure out how to reproduce, or at least how to give advice and guidance on engaging actors at the community level. So I would love to hear from you both at this top level with the upcoming COP, who needs to come to the table there at the very highest level, and then what are the observations or the practices that have really worked to bring more awareness and more engagement of stakeholders at the community level and get them engaged across sectors as well in responding to some of these threats to the environment and ecosystems.
So who needs to be at the table? I can't think of anyone that doesn't need to be at the table. I honestly can't. But that being said, the health sector has typically been very reactive, and it doesn't really necessarily go to prevention at source. And this really is an opportunity to do so. So who needs to be at the table at the highest level? We need to make sure that at the next COP, at the next climate COP, we do have health ministries meaningfully involved, and not just the few that are going to be for instance, at the very first ministerial health and climate roundtable, which is also going to be taking place concurrently. So we definitely need to see a lot more engagement from the health sector to really raise the profile and raise the voices of health, or rather as of climate change as a health issue and as the ultimate health opportunity. And that goes from everyone working from within ministries of health all the way through to frontline workers that really are at the front lines of natural resource management. And that, I think, touches a little bit upon the question that you had raised on, well, what really needs to be done at the community level. At the community level, one of the things that we need to bear in mind is that, for instance, there have been some communities, there have been some populations that have been traditionally marginalized from these discourses, that have not been at the table as equal players. So the first thing we need to do is bring them to the table as equal players. And I'm thinking specifically, for instance, of Indigenous peoples. I mean, if we're talking about Indigenous peoples, 80% of the world's biodiversity is managed by Indigenous peoples. Yet they're not the foremost stakeholders that are at the table. Stakeholders and rights holders, I should say. So that is absolutely something that we need to do. Within WHO, one of the things that we are doing is, for instance, we held a very first workshop on biodiversity, traditional knowledge, and health very recently in July. And that was in the lead up to the first global conference on traditional medicine and in the lead up to the G20. So some of the discussions that took place in that week-long workshop were specifically on how do we meaningfully engage, what needs to be done, how we bring you to the table. So of course, there are mechanisms that need to be created to ensure that there is an equitable dialogue. And so one of the recommendations, for instance, that came out of that workshop is that in the lead up to what will become the very first Indigenous health strategy, which is the result of a very recent World Health Assembly resolution that was adopted just in May, Indigenous people need to be around the table as to co-design that strategy moving forward. So we're seeing that there are some steps being taken at the international levels, but these are not moving nearly fast enough to engage from the ground up. I think there's definite hope and potential for that to be strengthened moving forward, but we're also seeing that there's a lot of work that is actually being done at the community level, and these need to be supported. That Conservation Works project that Catherine can talk to you about more does tremendous work, including by engaging with Indigenous peoples and local communities. There are other, NGOs that are working with people at the ground level. I can think of Health in Harmony, for instance, which often comes up in our discussions as ways that we can really maximize some of those co-benefits and help to balance some of those trade-offs. So really, who do we need to have at the table? I would say everyone, but we need to ensure that the mechanisms are in place so that it can be a conversation of equals. And there should always be that element of co-design. Catherine, maybe over to you.
Yeah,
You have so much to add.
It was brilliant. No, it's perfect. You covered everything. I would just say, I think the private sector, they're part of that, everyone, of course, and but really from the local level, engaging them and sometimes they can mobilize resources in ways that communities can't. I think that interaction we need both, and it is really context specific, as you say, about who is it, the village elder, is it, the village chief, is it the traditional healer? I think community health workers too, they're a wonderful asset. They're not always trained on climate climate links and that awareness, and how do we best get people aware so that they can take action and really protect the environment, but also reduce exposures. I think that's really crucially important, especially as things are changing quickly in terms of what is happening to the environment, but also just transitioning to increasing energy access. We want good things to happen, but it has to be done in a green way, or else there will be local and global health risks. So I think if there's a way that we can mainstream climate awareness and also biodiversity awareness across all of the health sector training in ways that are very specific to the work that they're doing, I think that is really crucially important. I think that will take some investment too, and I know WHO is doing brilliant work on that. I think that we can support them in that work and all the trainings that each of us are collectively doing, all the entities that we're working with. Thank you for the wonderful question.
Well, thank you. And I think that's really also thought-provoking on what we can all do as part of the non-governmental community, because I think there's most of us who are stalwarts and who are left here on this call represent either academic institutions or non-governmental implementing partners, and thinking about how we take that from a concept and make it really targeted. How do you make sure that the people who are being trained are being, that we identify usable operational information on biodiversity, on climate change, on conservation, and incorporate that into public health training on the animal and the human health side in a way that's meaningful, and not just I think it's very easy to do a cursory overview with a lot of statistics that admire the problem, but harder to make that into a meaningful and adapted training curriculum that is specific to roles. And I think that's really a place where we could all have a huge impact for the people who are on the job training now, as well as for the next generation. I see that Justice wants to ask another question. I'd like to recognize him. If anyone else has any questions, please go ahead and let us know in the chat so that we know if we should hold out a little longer for some more questions. Otherwise, I'm going to turn to Justice, and then we'll see if it's time to thank our speakers and to wrap up. Justice?
Yeah, thank you for the presentation. I've really been sensitized on matters of environment and health. I'm a scientist, but I didn't know that a health ecosystem leads to a healthy population. Now, I just saw a gap concerning your question on who should be on the table. Like the other week, we had a climate summit in Kenya. And what I've just identified through the presentation is that we've been getting it wrong. Everything is just wrong because the people who sit on the table, I don't think they're going to bring much. We have a lot of work to do. That is what I can say. Yeah, we have just a lot. That is the few words I can use to say it. Yeah, thank you.
Yeah, thank you so much for that reminder. I'm going to ask now if any of our other participants have a question or a comment they'd like to make. Notice a couple of people coming off mic and coming on camera. All right, I appreciate, thank you both, the questions, the conversation, and the presentations. Catherine and Christina, thank you so much for that really comprehensive set of observations and the framework you've given us all to think about where we go in global health and in research to integrate across all of our disciplines more fully into this One Health or planetary health framework, how we can think about biodiversity, ecosystems, services, conservation, and to integrate that across disciplines. I'd like to thank you on behalf of CRDF Global for our Global Health and Action series for being here as part of that today. I'd like to thank you on behalf of the Global Health Operating Division at CRDF Global. Look forward to working with you all in the future and appreciate all of the insights you shared today with this community. We will be sharing the presentations for those who have participated today so that you can go back and reference this later. We'll be sharing at least the talks that were given today so you can go back and capture them later. I know that I'm going to review them again. They were so rich. I'm going to go back and listen to this and watch it again. So thank you so much for your time. Much appreciated.